Yeah, hi, hello. Today, let us discuss about kidney transplantation. This video is to create awareness about kidney transplantation and why, what is the task, what is the work they will going to perform in our body. Okay. Before talking about kidney transplantation, let us look into our digestive system. See, the food, what the water, the fluids, nothing but water. That's what it is. One type of fluid, or fluids or food, whatever we take inside our body will be digested. Okay, the partial digestion will be done in mouth, and that will be entered into our duodenum. Then after entering into duodenum, here what is going to happen means the pancreas will going to release some pancreatic juices, and liver also some release some enzymes into our digestion here. Okay, inside this stomach here, the pancreas is nothing but the one which, nothing but we are all talking about diabetes, right? Pancreas, it will going to release pancreatic juices into our digestive system. Okay, our into our stomach, and this liver will going to release some enzymes for digestion. Okay, then after it going to enter into our small intestine. This is the small intestine, the way this is where the actual digestion will going to happen. Inside the small intestine, we have something called villi, where the blood going to observe like proteins and the potassium, sodium, whatever maybe the things, proteins and everything present in our blood will be observed in our food is observed through villi. Then it will be the things which is required for our body, because if you want to get energy, we should have proper protein to our body, then only will be active. Okay, that will provide energy to our body. Everything, what are the things required to our blood will be observed, what are presents, what are the proteins, potassium, sodium, fiber, whatever maybe, what are the things present in inside the food what we have eaten will be observed in the small intestine through villi, and that will be entered into our blood. After entering the blood will be passing through entire the body through circulatory system, like for heart will come under circulatory system. Okay, and it will going to circulating throughout the body, and sometime at some point of time it going to enter into our kidneys. What is the function, what is the main function of kidneys, we're going to see step by step. There will the kidneys will going to filter out the blood. Okay, and it will going to divide, it going to separate the toxic materials, toxic liquids that are present in our kidney, blood, and the good blood, and the blood which contain good proteins and good amount of protein and everything will be passed back to heart. Okay, the remaining, the wastage, the toxic materials what are present in our blood will be moved, will be come out of through urine. Okay, this is the anatomy of what is the excretory system. Before talking about this, you all know that excretory system nothing but to remove the wastage from our body. Okay, okay, let us look into human excretory system. Excretory system, see, this is renal vein and renal artery which comes from heart. Okay, through circulatory system the blood will comes like this, and it will be entering into our, both of our kidneys. One is right kidney and left kidney. The kidney size will be, the both heart and kidney size will be same as our fist or hands fist. Okay, here inside, okay, inside our kidneys there will be something called as nephrons. Inside nephron there will be some filtration units called glomerulus, thousands, millions of glomerulus, where the actual filtration will be done. Through glomerulus only, the bed filtration will be going to happen. Here, what is human excretion? They are going to have pair of kidneys, pair of ureteries, pair of a urinary bladder and urethra. These are kidneys, these are ureteries, these are urinary bladder, and this is the urethra, where from where the urine is going to go out. Which is nothing but excessive wastage or toxic materials which are present in our body in the form of urine, they are going to go out. Okay, let us talk about kidneys. Kidneys are bean shaped structure located on either side of the black backbone and are protected by ribs muscles of the back. Each human adult kidneys have length of 10 to 12 centimeters, a width of 5 to 7 centimeters, and weight around 120 to 170 gram. The kidneys have or an inner concave structure. The blood vessels, arteries, and nerves enter the kidneys through hilum, which is a notch at the inner concave surface of the kidney. The renal pelvis, a large funnel-shaped space, is by the inner to the hilum, has many projections known as calculus. Okay, we'll see one by one. Just for brief introduction, I'm giving this theory about this kidney. Okay, this is the anatomy of kidneys. How this is how we going to look inside our kidney. This is the outer shape. This is the inner shape. Interior of kidney, exterior of the kidney. This is the renal vein, renal vein, cortex, papillum, medulla, major plaque, pelvis, everything. Okay, these are the filtration units. Okay, right kidney, left kidney, ureters. Okay, this is how the kidneys will going to look inside and outside. Okay, structure of kidney capsule. The outer layer is called capsule. Inside the kidney there are two zones. The outer zone is the cortex and the inner zone is the medulla. Okay, that's what we have seen, right? Cortex, medulla. Okay, outer layer, inner layer. Okay, this cortex extends in between the medullary pyramids as renal columns called columns of Berman. Nephrons. I have already told you that nephrons are the functional units of kidney. Each nephron has two parts of glomerulus and renal tubules. Glomerulus consist of a bunch of capillaries formed by different afferent astrolus. Blood from glomerulus is carried away by efferent arterioles. The renal tubula starts with a cup-like structure called Bowen's capsule. Okay, and this encloses the glomerulus. The Malvin body consists of glomerulus and Bowen's capsule. The highly coiled structure is in the tubule next to Bowen's capsule is proximal elevated tubule. Okay, this is the anatomy. Okay, let's move forward. Just for awareness, I am telling this theory all. Okay, ureters. These are nothing but ureters. After filtering the blood, the filtered blood will be going back to heart, and the wastage and the toxic materials will be going out through ureters into our urinary bladder. Then after going to be out through urethra, which is nothing but urethra. Yeah, see. Yeah, ureters. A pair of thin muscle called tubes called ureters comes out of each kidney, extending from renal pelvis. It carries urine from kidney to urinary bladder. Urinary bladder. It is a muscular sock-like structure which stores urine. The urinary bladder is emptied by process of micturition. That is the act of urination. Urethra. This tube arises from the urinary bladder and helps to expel urine out of the body. In males, it acts as a common route for sperms and urine. Its opening bordered by sphincter muscles. Sorry. Yeah. Blood, that's what I told you previously. Blood contains both useful and harmful substances. Hence, we have kidneys which separate useful substance by reabsorption of toxic substance by producing urine. Kidney has a structural filtration unit called nephron where the blood is filtered. Each kidney contains a million nephrons. Okay, inside that nephrons only you're going to have glomerulus and tubule. Capillaries of kidneys filter the blood and essential substances like glucose, amino acid, salts, and required amount of water get reabsorbed and the blood goes into circulation. That's what I told you. After filtering, the filtrated blood will goes back to into blood into our body for circulation. The toxic materials, the wastage which are present like sodium, whatever may be, okay, that will be come out of through urine into throughout our body. Excess water and nitrogen waste in humans are converted into urine. Urine thus produces a pass to the urinary bladder via the ureters. The urinary bladder is under control of central nervous system. Okay, the brain sends the signal. Yeah, we'll be getting when we are trying to pee or urine from our urethra. We'll be getting like a urgent in the pay. You are getting that the signal will be sending from our brain to that is signal will be sending by our brain. Okay, the urinary bladder is to contact and through the urinary opening called urethra we execute the urine. And urine formation. The urine is formed in the nephrons and involves the following steps: glomerular filtration, which are used to filter our blood. This are used to filter our bloods. Okay, mainly glomerular filtration. By glomerular filtration, there is one test called. By that we can say that how much capacity that our how much capability and capacity our kidney has to filter out our blood. Okay, by this test we can say, okay, glomerular filtration test. It is a primary step to urine formation. In this process, the excessive fluid and waste products from our kidney are filtered out of blood urine into the urine collected tubulets of the kidney and eliminated out of the body. The amount of filtrate produced by kidneys every minute is known as glomerular filtration rate (GFR). This is the common test when doctor going to advise for testing how much the filtration is going to happen in our body through kidneys. Okay, this is the common test to check the filtration rate. Every nephrologist will going to advise when they have some doubt. Okay, to check how much filtration rate is going to happen in kidneys, the nephrologist will going to suggest to do the GFR rate, okay, glomerular filtration rate. Tubular reabsorption. It is the absorption of ions and molecules such as sodium ions, glucose, amino acids, water, etc. So water involves passive absorption, while the glucose and sodium ions are absorbed by an active process, secretion. Potassium ions, hydrogen ions, and amine are secreted out to maintain the equilibrium between the body fluids. Micturition. The urinary bladder is stretched and gets filled with urine formed in the nephrons. The receptor present on the walls of urinary bladders and sends signal to C. This is what going to the receptor present in the inside our urinary bladder. It will send a signal to our brain, central nervous system, thereby allowing the relaxation of sphincter muscles to release the urine. This is known as micturition. Okay. And what causes this kidney infection? What are the signs on how the kidney infection, what are the causes for kidney failure, what how can we say that the person is going to have some kidney diseases from where? See, we'll be seeing step by step. I'm going to explain very well about that. Kidney infection. When we have some kidney infection, signs of and symptoms of kidney infections are backside, flank, or grain pain. Okay, backside we will be getting some pain, fever. Yeah, the fever also will not be continuously. It will come at night and it will go from daytime. It will going to go that like that. Some gap. After some gap, it will be getting fever, and after some time, it will going to be not getting fever. Okay, in that way, coming fever by giving some gap. Okay, this is called. We can expect that there is some infection in our kidney and abdominal pain, frequent urination. This is the common thing when we all people will be experiencing when they are having the urinary kidney infection or UTI, which is called as urinary tract infection. Most commonly experienced to among all people, 90 to 95% are experiencing this UTIs, urinary tract infections, frequent urination, nausea and vomiting. Okay, and people with kidney disease symptoms, the persons who has the diseases of kidneys can experience these things like swelling, fatigue, and weakness, changes in urine. Will be going frequently, like especially in night time, and we will be not getting any enough sleep. Okay, nausea and vomiting, high blood pressure, shortness of breath, itching. These are some common factors that say that we have some kidney disease, and we have to check our kidney condition whether it is running successfully or okay. We have to take them. We have to take care of the kidneys because there are some. We have to assume that they are like kids. Okay, we have, and these are some common factors. Okay, especially I will tell you, okay, in detail about these things, how it will happen, what causes kidney diseases. Okay, in my point of view, these all factors will cause the kidney disease. Okay, diabetes, high blood pressure, infections, kidney stones, inherited is nothing but the from our ancestors. Okay, from genes, obesity, excessive weight, smoking. Okay, diet high in sodium and diet high in sodium means high in salt. We'll be taking excessive of salt and processed foods like outside food and fats. Okay, these are some common causes, and in not only in my point of view, generally diabetic is the number one cause for kidney failure. Okay, dialysis. The one who got kidney fail, both the persons whose kidneys, both of them are failed, then they are preferred to go undergo kidney transplantation or dialysis. Under certain circumstances such as poor blood flow to the kidneys, infections, injuries, etc., the kidneys fail to perform their function. In such situations, artificial kidneys are used for blood filtration, and this process is called dialysis. We all know that, and we have learned in our childhood itself that dialysis is nothing but is a artificial kidney. Okay, and there are two types of dialysis: hemodialysis and peritoneal dialysis. And among these two, hemodialysis is the famous one and is the accurate one. And peritoneal dialysis is in used, we can do it from our home, but hemodialysis we should visit our hospitals. We can't do it in to home. In peripheral dialysis, they will be keeping some catheter inside near our belly, and will be the filter. It will be doing 3 times a day. And hemodialysis, we will be keeping perma catheter to our hand or to our near our throat. Okay, for doing dialysis. Among these two, hemodialysis is the famous one, and it will be the best one for dialysis. Okay, and biopsy. When doctors will go for biopsy means if the doctor is unable to find out that if you want to get a clear cut idea, you want to get evaluation, what is the cause of kidney failure, and what if we can't understand accurately by seeing conditions and symptoms, you will go for biopsy. By biopsy, you will get a clear cut idea what is the cause for kidney disease, what is the causes of disease. Okay, there are two types of biopsies: percutaneous biopsy, open biopsy. A doctor inserts a thin biopsy needle through the skin to remove kidney tissue. Open biopsy, a doctor makes a cut in the skin near the kidneys to determine the area from which to take the tissue samples. The second one, open biopsy, will be giving the exact reason why, what is the nature of disease, why, what is the reason for getting that disease, and what are antibodies. These are something what we have to discuss. This is related to body, not only for kidneys. Antibodies, this will act as a security to our body. If any foreign objects enter into our body, like we are Indians, and we there is some soldiers in near our borders. Okay, in every border, and we are not allowing other soldiers to enter into our body, to enter into our country. In the same way, when the antibodies will going to work in the same way how the soldiers will going to work in our border. The antibodies will work, how they're going to work means if any foreign object like in COVID-19, if it enters into our body, the antibodies will going to increase our WBC count, and this going to attack the the object which is came outside into our body, and this will try to kill them. In the same way, the antibodies will going to work as immunoglobulin, the immune system. These are soldiers. When some outside object is came into our body, like whatever maybe like bacterial infections and any organs kept in our body, this immune system, how it going to act as irregularly. This going to try to attack that organ which is came out from outside, in order to stop this attacking of other organ which is kept in our body. These doctors will going to advise some immunosuppressive medicines to the kidney transplant patients. So he have to take the rest of his life that medicine, because our body has the capability to recognize which organ is ours and which organ is not ours. Okay, that's why doctors continuously advising the patient to take the medicines regularly, in order to suppress our immune system, in order to control our immune system without attacking the outside organ. Okay, donors organ, whatever maybe, like whatever maybe the transplantation, kidney transplant, heart transplantation, lung transplantation, liver transplantation, whatever maybe the things. Okay, okay, we have to discuss about this antibodies. There are mainly 5 types of antibodies, also known as immunoglobulin. Okay, these are large y-shaped blood proteins produced by plasma cells. They find to foreign particles and invade them. These particles are foreign bodies that get attacked by antibodies. See, that's what I told. If any foreign bodies are present in our body, they're going to attack. Types of antibodies: IgM, IgG, IgD, IgE, IgA. IgM is the first antibody produced in response to microbial attack by B cell. It is the largest antibody in the form, and it is found in a penetric form. IgG Most abdomen isotype in the plasma and comprise 80% of the total antibody content in the serum. It detoxifies substances that are harmful and recognize the antibody and antigen complex. Okay. And let us think about rest of the antibodies: IgA, IgD, IgE, usually found in the liquids such as breast milk, serum, saliva, fluids of the intestine. IgA is the breast milk protects as infant gastrointestinal tract from microbial activity. IgD, it is involved in the production of antibody by B cells. IgE, it is present in the least amounts around 0.02 of the antibody content in the serum. Among five antibodies, IgM and IgG are most dangerous and important. Okay, in some cases, even though some person loses his kidney, he won't be suggested to go under kidney transplant, because even though he goes for a kidney transplant, the transplanted kidney will also be getting rejected due to high immune system by IgM and IgG. This will going to act irregularly and will going to attack the donor's kidney. Okay, let's move forward. How this is where the kidney transplant will go into. These are the kidneys. Diseased kidneys is nothing but the kidneys whose kidneys got failed, and this is the donor kidney, transplanted kidney. The kidney which is newly kept in our body. It is just kept in just above our legs. Front side will it will be keeping front side, not back side. Generally, the kidneys will be present back side to our body, but the transplanted will be kept in front side just above our legs. This is the bladder. See how the transplanted kidney is received from our donor. The donor's renal artery and renal will be cutting from the body, and along with that, they are going to cut uretry on uretries also. They're going to look for there are some tests to perform whether uh, either the recipient body will going to accept that kidney or it will going to reject it. They will be cross-checking before itself. Okay, after performing some test only, they will going to go for kidney transplantation. If there are some famous tests before transplant, we can say that the transplant will going to last on or will going to accept the recipient body or it going to reject. We can say, but not 100%. We can say 99%. We can say it. Okay, in that way they're going to cut the renal artery and renal vein and the uretry, one of the uretry from the donor's body, and it will be kept just above our legs. Front side it will be keeping, and it will going to attach to our renal artery and renal vein and to our urinary bladder. For at the time of transplant, they will going to keep one stunt to our uretry and to bladder. Then after 1 or 2 weeks of the transplant operation, they will going to remove it. Okay, they will be keeping in hospital 1 to 2 weeks to observe whether the transplanted kidney is working effectively or not, by checking the regular by they are going to continuously monitor what are the is conditions like diabetic, they are going to check sugar levels, bp levels, everything, or urine output. And if everything is goes right, then they are going to discharge after 1 or 2 weeks from the hospital. This is where the kidney transplant will go into work. And the conclusion, the best quality of life comes from successful kidney transplantation, because the best treatment for the one whose kidneys are not working properly or whose kidneys lost the capability to filter the blood effectively, dialysis. Dialysis is the best artificial kidney which is used to remove toxic materials from our body, and it is the option to the person who doesn't have the option to receive the kidney. It is the only option to make the person survive. It won't give the quality of life like kidney. Yeah. See, dialysis is also can act as a artificial kidney, but it won't give the quality of life what kidney transplant will going to give. Because in kidney transplantation, we can live a happy and normal life as we are living it before, but there will be some restriction regarding food, and some we have to take some medication to rest of our life. And what is the thought of the day? What I have learned in my life: live for today, because you never know what tomorrow brings or what it can take away from your life. Okay. Okay, now talk about this in detail, how this is going to happen, how the symptoms will go. See, if we have kidney disease, we'll be expecting that the food what we going to take inside our body will not be digesting very well. We will be continuously getting probes. Okay. And there will be swelling around our ankles, and there will be swelling around our eyes and around our face, and we'll be every time we'll be feeling like lazy, and we'll be not getting enough sleep at night, especially at night times. We are frequently getting urination. These are the things we're going to experience the person who has the kidney disease. Okay. And the diabetic and hypertension are the number one cause for the kidney failures. If you have diabetic and the kidney hypertension, you have to check whether they are in control or not. If they are not controlled, ultimately they are going to damage our kidneys. Because if the uh, kidneys won't filter as accurately. If the diabetic is nothing but sugar levels are high in our blood, this glomerulus will going to getting damaged day by day, because it's want to try, it want to continuously filter the sugars, okay, through glomerular filtration units. It can lose the capability, the filtration units can get damaged. Okay. These are some symptoms. Okay. And if you have hypertension and diabetic, you have to take care of them. And you should take regular medications, and you have to keep them in control. And especially in case of diabetic, the second option is hypertension. And what causes kidney failures means diabetic, hypertension, ancestors like genes and some unknown reasons. Okay. Mainly these are some reasons. And the painkillers, if you are taking excessive painkillers, that going to damage our kidney. What are the things that require for going kidney transplant means the O positive, the one who has the blood group O positive can donate. Okay, he is the universal donor. And the B, the one who has B can give to whatever, maybe like B negative or B positive. He can give the kidney, he can donate the kidney to recipient, and he has the B. What only O can donate, and if he has A, B or AB, whatever may be like a sign negative or positive, he can donate. But O plus is the O, not only, yeah, O plus is the universal donor. Okay. And these are some things required for the kidney transplant. And they're going to check before going to kidney with the, if they're going to check for liver LFT, like a liver test, heart test. If we have any heart related problems, they won't be going for kidney transplantation. Because people who has the heart disease have high chances of getting heart attack or stroke. And they're going to check for like a heart pump rate. It is erection fraction. It should be normal range will be 55 to 75. If the range is in between 55 to 75, then only they will going to proceed for, before going kidney transplantation. Cardiologist is nothing but heart doctor want to give permission. Yeah, he is fit to undergo kidney transplant. Then only the nephrologist and urologist is going to proceed for kidney transplantation. They're going to plan. Okay. The heart rate will be EF should be, not EF, will be, should be, it's a mandatory one, should be in between 55 to 75. And the LFT you have to check whether there is joint raise, and there will be HGPT, HGOT, and these are the things which denote that how whether the liver is normal or not. This is going to show. And it is mandatory to keep, if you have see, if your kidneys are not working well, ultimately it will give some, if one organ in the body is not working well, ultimately it will show the effect on entire body. See, if kidneys are not working very well, it will affect on heart. And if in the same way, it will going to affect the entire system. Like it will going to affect the mainly we have five major organs like kidney, liver, lungs, heart and brain. If if one organ is not working well, that effect will be fall on all organs, all major organs, not only all major organs, entire system, entire body, it will be falling. And we should keep that, if your kidneys are not working well, generally it will be showing in the form of diabetic and hypertension itself. It will be, if we have any hypertension, is nothing but BP and diabetic, we have to keep them in control in order to be in a safe zone without getting kidney disease. Okay, diabetes can cause kidney failure. Diabetes can cause a retinal, like a high problem. Diabetes can cause some heart related diseases. Yeah, in diabetes the number one cause for kidney failure. and hypertension also. But if we are not getting keeping in control of diabetes and hypertension, it can harm our heart also. Okay. And what tells that kidneys are healthy or not? There will be some test like a serum creatinine. If the zero, the female, the range, the normal range for female is 0.6 to 1.3, and the normal range for men is 0.7 to 1.4. If the creatinine levels are above 1.5, then we have to consider that our kidney started failing, our kidney started damaging. If it's gone above 2 means, and nearly 40 to 50% of our kidney got failed, and they will going to keep you on some medications in order to stop our transplant for some days. And if when it reaches like serum creatinine level 7, 8, 9, then they're going to proceed for kidney transplantation. And after transplant, the kidney creatinine level should be below 1.5. If it goes 1.5 above 1.5, we have to look into it, and they're going to do some biopsy to the transplanted kidney, and they're going to check whether there any chance for rejection, and they're going to check. And what types of kidney disease mean? There will be chronic kidney disease, acute kidney disease, genes, painkillers, there are something. And if suppose we are going in somewhere, and some suddenly one snake come, and it is bite me, then it has bited up. Okay, then if it bite us, we have to admit in a hospital. Then our kidney stop working. This is called acute kidney rejection. After one round of dialysis, it's going to work in a normal way. But whereas this chronic kidney disease, CKD, AKD is acute kidney rejection. Acute kidney rejection, okay? Acute kidney rejection is completely different from CKD, chronic kidney disease. Chronic kidney disease is nothing but there will be a progression slowly. The kidneys will go into damage slowly, day by day, day by day. This is the danger. We can't see up to our kidneys get damaged 60 to 7%. We can't even get the symptoms. That is the main headache with the kidneys. We can't tell whether we have disease or not. We have to check whether through you complete urine examination test, okay, CBP and serum creatinine. And we have to check for electrolytes. Is there any if you are if you are in our urine we are losing our proteins means that is a high chance, there is high chance of kidney failure, because the kidneys got the cap. If kidneys lose the capability of filtering our blood only, then it's going to release protein into our, see, protein is required to our energy, to it should stay in our body, and it should stay in our blood in order to keep energetic. Okay, but if it loses, the kidney loses the capability of filtering the blood, then the thing which is present in our blood, like proteins, these are very essential part to our body. Okay, in order to keep us energetic, that proteins will be breaking in our urine, means that is the high chance that the kidneys filtration units are getting damaged. Okay, and what are the things should take after kidney transplant? Before kidney, the person who has a kidney disease means, the one who has kidney disease should try to take more food in more in fiber, less in fats. He should avoid maximum red meat and sweets, everything he can take, but in a limited, but he should avoid red meat completely. If the normal person is taking 1 gram per kg, you should take 0.6 gram per kg of protein every day. 1 gram. See, this how we going to take means by calculating body mass index. Based on our height, we should have our weight. Then only our body will going to work properly. Excessive weight gain can result in diabetic, and they're going to cause so many problems. Okay, but in order to avoid that, we should be aware of these things. Okay, these are some common factors what we have to take, like we have to avoid outside food, and we have to take more fiber and less in fats, like vegetables, fruits, high in potassium, sodium. Okay, most probably we have to take more fiber, less in fats, then only you'll be getting a best, leading a best quality of life, because red meat contains high source of protein. That's why it can affect our kidneys. Okay, not only the person with the kidney disease, Everyone should avoid red meat. Occasionally it's okay, but it should not be every day. Okay, this is where the kidney transplant will go into. After kidney transplant, the doctor will be giving some medications like immunosuppressives, and some, if you have diabetic or hypertensive, they will be giving some medications after transplant. Before transplant there will be so many changes. After transplant, if you have diabetic or hypertension, it will be getting controlled, and if not, you have to keep them in control. And they will be giving some immunosuppressives earlier. After transplant they will be keeping on steroids. Then after, by checking your condition, they will going to reduce them. And here we have to think about this immunosuppressives. The side, there will be some side effects with immunosuppressives. If you are on immunosuppressives, we should not stay more in a sunlight, because there will be a chance of getting some skin diseases like skin cancers, etc., etc. And due to that medications, we will be on post after kidney transplant, nearly 1 or 2 years we will be having some idosis. Due to that, there will be excessive of air growing on our body, and some dizziness when we are exposing to sunlight. Okay, we should avoid it. Okay, these are some things what we have to think about it. This all are about kidney transplant. And when it comes to marriage, you can get married, and we can have very good sexual life. That's not an issue. And but what differ having a baby means, you can have baby after kidney transplantation. But the thing what we have to discuss about kidney transplantation, both men and women, is the one who underwent, if you talk about men, the one who undergoes kidney transplant can have marriage and can have baby also. That's not issue. But when it comes to women, there will be some, the woman who undergoes kidney transplant, there will be some complication during pregnancy, because the kidney is kept in front side, it's just above our legs. There will be some complication during pregnancy. That is the thing. Apart from that, the one, there is nothing, no need to worry about it. Then we can lead happy life. Um, average lifespan of donated kidney is nothing but, the one who receives the kidney from deceased can last average of 10 to 15 years. An average, it's not a accurate number, an average, we are telling an average. And the one who receives from living donor can have kidney lasting about in between 20 to 30 years, an average. In world, the highest surviving kidney transplant patient is 55 years. And in our India also, there is some patients who have we are living after kidney transplant still they are living after 40 years of kidney transplantation. If we are receiving kidney and getting rejected, it can't affect our life. But if you what if the kidney what we have received got rejected, means you should go, there will be no treat to life, but he should undergo another kidney transplantation. But uh, the quality of life may be missing. But yeah, when compared to on dialysis, the best quality of life comes from kidney transplantation only. Most probably, doctors are advising to take kidney from our relatives, like mostly from mother and father. In India, there is one permissions only to receive a kidney from our relatives, who are maybe like they should be our relatives, father, mother, children. But doctor mostly advising you to take from parents, because the tissue will go into match, not about the blood tissue. If the tissue match, the kidney will go into run for a longer time, like a 20, 30, 40 years even. Okay. What if the kidney loses after 20, 30 years? Maybe you should undergo again kidney transplantation. But in India, we have to take only from the relatives itself. We don't have any permissions to take from our others from strangers. But in America and some foreign countries, they are doing that kidney transplant from strangers, if he agrees to donate one of his or her kidney. Okay. And what are the things required to donate a kidney means, he should not have any diabetic or hypertension. No, he should not have any disease. Okay. If he have to suffer, because doctor won't advise to take kidney from the donor if he has any diseases like hypertension, diabetic. Okay. These are some things what we have to discuss all about it. Okay, anyway, after kidney transplant, you're going to have normal life. We will going to have, we can have marriage, we can have babies, but only thing is in women there will be some complications during pregnancy. Okay, and these are some things what we have to discuss all about. Okay, so we have to take some restrictions, we have to take some precautions. Okay, we have to take medications regularly in order to keep our immune system in control. Thanking you. I hope I have explained you very well. I am making this video to just create awareness about this kidney transplant. Thank you.